Hi, everyone. We'll get started in just a moment here. We're going to give a minute or so for everyone to log on. All right, we're going to go ahead and get started. Welcome, everyone. Thank you for joining us on our Wednesday State of the Community webinar, Business Planning for Fall. It's hard to believe it's almost fall. It's so hot out. I'm Kim Casco, and I'm President and CEO of the Iowa City Area Business Partnership. And on behalf of my peers at the Iowa City Area Development Group, Iowa City Downtown District, and Think Iowa City, thank you for joining us today. The purpose of today's webinar is to learn more about what some of our local businesses are doing to navigate the workforce challenges associated with COVID-19, from protecting the health of their employees to supporting working parents who have kids who are going to be learning from home this fall. On last week's State of the Community webinar, we got an update from our university leaders and our K-12 leaders on their return to learn plans. So today is really about focusing on how businesses are adapting their policies and procedures to address the potential impact of those plans. Before we dive into that, I have a few brief housekeeping items to cover and a quick update on some of our Project Better Together efforts. First, starting with how to ask questions. And so we, as always, encourage audience participation in this webinar, and you could do so by submitting a question via the Q&A box. You just pop that open, submit your question, and we'll let you know that we've received it. And we'll try and get to as many as we can. Sometimes that's not possible. We can follow up offline, but we appreciate, having many questions come in. We also are recording this webinar, and we will share out that recording with attendees after this, as well as the slides. Resources. We always like to share the variety of resources that we have available for you. So as always, we're putting them on our icareatogether.com website. We also continue to do a weekly newsletter every Monday. You can sign up for that via the website. And if you haven't been on our website yet, please check that out. We have a variety of resources from COVID-19 related signage and toolkits to where we post our webinars. We recently added resources around derecho storm recovery, and we also provide updates on our Project Better Together effort. And speaking of that, one of the things we're most excited about is holding our own Shop Local gift card campaign. And this is a campaign that seeks to incentivize consumer spending. And if you've spent $150 or more locally, you can submit your receipts and be eligible to receive a $20 gift card from up to around 200 businesses or so on our website now that you could pick a card from. And also as part of that, $5 is donated automatically to our BIPOC and immigrant-owned business support fund. And we're really excited to announce just this week, we were able to fund 33 BIPOC and immigrant-owned businesses with a total of $52,000. And these are businesses, the majority of which have not received any prior funding or support. And so we encourage you to continue supporting all of our businesses locally. They really need it with a lot of the uncertainty that continues this year. Another set of resources I want to continue to encourage people to check out are, of course, our hospitals, and not just when you're feeling sick, but their websites have tremendously valuable information about COVID-19. Each of our three main hospitals have a website dedicated to it. They've got videos, they've got chatbots, and also most recently, actually today, the CEO of Mercy Iowa City asked me to share with you all that in the coming weeks, they're going to have the ability to test over 1,000 individuals per day. And if any employers wish to learn more about that, they can contact their laboratory director, Ivana French. And again, we'll be sharing these slides, and I will try and remember to stick that information in the chat. And lastly, what I want to do is just share some quick survey data we've recently received. So we sent out a survey the past couple of weeks, just a quick and dirty pulse survey to our business community, asking a variety of questions around COVID-19 and where our businesses are at. And we had about 120 businesses that responded, and it was just a cross section of industries. We learned that 66% of the respondents who completed the survey reported a decrease in sales, with the majority in the 1% to 50% range. Only 5% reported actively considering a business closure. And on a scale of 1 to 10, measuring the current level of confidence that your business can weather the next 6 to 12 months, the average score was 7.8. So while we don't like to see those reduction in sales, we were glad to see that there's a decent level of confidence moving forward. 55% reported having the same employment level or increased levels. 26% are looking to hire new staff in a variety of different positions. Only 4% need help sourcing PPE, and 13% are interested in health screening and COVID testing. And then lastly, another couple quick data points are over 50% of the respondents allow employees to work remotely or in a hybrid fashion, depending on their role. And over 55% have the ability to offer flexibility in schedules to accommodate for childcare. And this is exactly the topic that we are talking about today. So with that said, I'd like to now introduce the panelists we have with us today. We're really lucky to have them and grateful to have them share what they're working on. We've got Janet Godwin, who's the interim CEO of ACT and the Iowa City Community School District board member. We've got Soni Harney, who's the Senior Vice President of Human Resources with MidwestOne Bank. And we have Jennifer Banta, who's the Vice President of Advocacy and Community Development with the Iowa City Area Business Partnership. I'm going to first turn it over to Janet here and have Janet tell us a little bit about what ACT has been doing the past 5 months to navigate COVID-19, protect the health of your employees, and then most recently, as we prepare for fall, how you're helping your employees, especially your working parents who are navigating having kids learning from home. So I'm going to stop my share of screen here and then turn it over to Janet.
Wonderful. Hopefully you can hear me fine. Kim, thank you so much for organizing this today. This is a really, really important topic, and I'm happy to be able to talk with the group today about some of the things that we have been doing at ACT since, my gosh, 5 months. It was mid-March when we decided literally overnight to move our workforce to a remote work from home model. We very quickly established that we had a few essential team members that needed to be in our campus buildings for various accesses that they needed. But since mid-March, we've only had about 20 to 30 people on campus. And for those employees, we have been obviously putting in all the safety measures, sanitation, social distancing. For those team members who were not able to perform their jobs remotely, but did not need to be on campus, we put in a sort of a maintenance means of keeping them employed, finding other things for them to do. And so that was a way we could keep as many of our team members whole as possible. I think one of the things that we found to be most critically important throughout these last few months is to talk frequently with all of our team members, to check in, see how folks are doing. You know, the first few months was a big transition. Students were at home, there may be other family members that needed to be cared for, and also trying to do your job from home. And so we found it was very important to check in, see how people were doing, what kind of support did they need. So we got into a practice of, pulse surveys, like what your group is doing, Kim, how are people doing? What resources do you need? How can we help? And then that helped us find some themes that managers or team leads could put into practice with their teams as they were all working in a connected mode. And we also asked questions around, do you want to come back to work? Or what needs to be in place for you to feel comfortable coming back to work? And so we just completed another one of those pulse surveys of our team members a couple weeks ago. And it's interesting, the team members' perceptions have changed since the earlier ones in April, May, June. There was a lot of desire to get back to work, especially as we started seeing positive cases trending down. Folks wanted to get back, they wanted to see their colleagues, they wanted to be back in the office. But this last survey that we did a couple weeks ago, I think the concern about positive rates in Johnson County increasing and in other hotspots around the country, we have team members all around the country. There was a more of a desire for folks to say, I'm more comfortable staying home. If I can continue to work from home, I would like to. And in fact, a large portion of our team member population is really not wanting to come back until we have a vaccine in place and widely available. And so our goal is to be able to provide options to team members wherever we possibly can. And so we do have a population that's ready to come back to work. And so in about the October timeframe, we'll create the physical spaces within our buildings to ensure proper social distancing. In some cases, we'll be putting up plexiglass barriers, ensuring that we've got, again, the proper sanitation teams on hand to be able to clean the facilities for those team members that really feel like they need to come back to work to feel good mentally and from a productive standpoint as well. For other team members, we're saying we'll be able to, as you're ready, start kind of bringing team members back to physical work in waves as folks are ready. So we'll probably see another maybe 10 to 15% of our population come back in the October timeframe. Most likely we won't see another wave until after the Christmas holidays. And so we're very lucky. We were able to transition to connected work for most of our team members and maintain levels of productivity that were good for our customers. But we also just want to make sure that we're serving the needs of our team members. So our goal is to communicate often and frequently, asking those questions: how can we help you be productive, take care of your children, take care of other family members that you need to be caring for, and also just acknowledging this is an extremely stressful time. Regardless, we're seeing, our friends and families struggle. We're seeing businesses struggle. We're all adjusting to a new way of integrating and working and socializing and entertainment. Our normal world is just really impacted. And so checking for signs of folks feeling depressed, checking for signs of people withdrawing and not engaging in the ways that they normally do. And so that's part of the reason we do those pulse surveys and check in on folks. But we really do pay attention to make sure people are doing okay in these really stressful times. So lots of communication, kind of, waves of team members coming back who are feeling comfortable, but providing the flexibility for team members to continue to work from home, who feel they have family members to care for, or they're concerned for their own personal health. And so those are some of the things, Kim, that we've been doing. I think if I started with communication and listening, and I think I'll end with that. That for us has been the most key component, is understanding where our team members are and how they're feeling.
Great. Thank you, Janet, for sharing all that. I know it's a ton of work. And like you said, there's so much uncertainty, and it's that flexibility, having options and all of that. We'll come back around to you to kind of talk a little bit more about, preparing for fall and return to learn. But I want to go to Soni next and have you also share what MidwestOne has been doing since the pandemic hit, in terms of protecting the health of your employees and balancing kind of working remotely and then kind of being back on site.
Okay, well, thank you, Kim. And first, just thanks for inviting me to be a part of this. It's an honor to help. And I just echo so many of the things that Janet said. So I'll try not to be too super repetitive, because I think a lot of us are doing a lot of those things, but some probably better than others. Just a little bit of context maybe is that our bank is 800 employees across 5 states. So again, similar to ACT, not all in Iowa City, or not all in the corridor, but certainly the same issues no matter where you are. And when the spring COVID surprise hit, we obviously responded very quickly and deployed about 200 of our staff out to remote work as well. And just wherever we could, and being a bank, obviously you got to keep some people in the office, and we closed our lobbies. We did that for safety, for communities, for customers, for employees. So did a lot of the similar things with just being very, very mindful of all of those little things with distancing and education. I can't express enough how much of a learning curve this was for everybody, for our leaders, for our managers, for our employees, and our customers. Just everybody was learning with all of this upon us, and just trying to keep communicating and keep trying to keep those lines of communication open was really, really important. We did provide some initial pandemic pay policies for people in the spring. We knew schools were closing, daycares were closing. We knew that there were policies to be developed, protocol to be developed for people if they became exposed. And so a lot of this was done very, very quickly. Our senior management team developed a COVID briefing every single day. And together with our Chief Risk Officer, Susan Moore, the two of us really tried to just lead that as best as we could and just keep everybody apprised. And then probably at the beginning of April, we also did a pulse survey with all of our staff, similar to Janet, and just wanted to know what our employees thought of how we were responding and if we were missing anything. And that was really, really good feedback to get. We implemented some manager forum weekly briefings, which was a call just to keep information in front of people. And our managers really, really liked that. We recorded it for people that maybe missed them. And we kept that up until we reopened our lobbies in June. And then we've now done monthly calls instead of weekly calls. And our senior management briefings have gone from weekly down, or every day down to weekly. So some of that shows progress. A lot of things have been developed. And then we reopened our lobbies, and then we started thinking about school. So, all of the lobby closures and then lobby openings, we did masks and we did distancing of our workstations. We did plexiglass with customer facing employees, and lots of different kinds of things that go along with that you see, almost everywhere in employers that are responding to this. We started to prepare for school knowing that this was going to be a big thing. And we did an initial bank-wide survey to try to identify who are our working parents and where are they. And we're talking about 5 different states, and we thought we knew where a lot of them were, but we didn't really have that data as much as we needed. We identified that we had about 175 working parents scattered throughout. And probably the biggest thing that we learned is that people were stressed, and people knew that what was in front of them was very uncertain. And so we then created, once we knew who our working parents were, we created some tools for our managers to get with each of those working parent employees and say, okay, What do you think you're going to do? They were waiting for school districts to make decisions, and many of them at the time of our survey, the districts hadn't been telling the parents what they were going to do. So it was sort of like, I'm really stressed and it's really uncertain and we have to wait to find out. But we wanted to start the dialogue, and we did. And this earlier this week on Monday, we released some guidelines for managers to start talking about what can we do for you, our working parents, in terms of, do you need flexible work arrangements? Do you need to have a reduced work schedule somehow? And we introduced some new different pandemic pay benefits for all employees that we kind of changed and transitioned from the spring, and then some specifically for those that needed to change their work schedules. So that is in the hands of our managers right now, and already the questions are coming on needing help with that. It's not easy, and we need to make sure that we ensure the safety of our employees and our customers and our workplaces, our communities. And now in Iowa City, we have some great information that is not so great, actually, that we've got increased spread, one of the top in the US, and anxiety levels just went really, really high. So I didn't mention this, but in the spring, we really did a lot of kind of internal commercials for our employee assistance program, because we anticipated that we had all levels of anxiety on that spectrum. We had people that were really, really frightened, and we had people that weren't, and people in the middle. So we wanted to make sure that they knew that there were resources there. And we also have really tried to encourage time off, unplug, reset, de-stress, take time for you. And we offered a couple of days for everybody in the bank that are called Just For You days, in addition to their vacation, that just says, take this, take a long weekend and enjoy yourself. Try to enjoy yourself, even if you can't travel. And so that's a little bit about what we've done. I guess I'll end with agreeing with Janet that communication is so important, but the thing that we've learned is to be compassionate and to try to be flexible, because it's not going to be one answer for everybody. It's going to be a different answer. And so we're doing the best we can, and we know that things could change tomorrow. And we also want to learn from our peers as well. So, just would end with that and say that it's not perfect, but we're trying our best.
Yeah, you're doing a lot there, Soni. Thank you for sharing all that. There's so many questions I have now between you and Janet. I want to again encourage folks, as you have questions, please put them in the chat. Otherwise, I'm going to hog this conversation. But I do want to bounce back to Janet for a moment, and then I want to bounce to Jenny. But I do, Janet, want to give you an opportunity, since you're on the school board, to give an update, talk a little bit about the district's return to learn plan, and then also talk about, put your ACT hat on and back on, and talk about, what some of the things that you're doing for team members to support working parents.
Yep, sure. That's great. Thank you, Kim. So from a school district standpoint, I think everyone knows we actually voted in mid-July to start school online. We tried to give some guidance to our Iowa City school families early enough so they could make plans. They could plan and be, and employers could work with their team members to make plans, and the flexibility that Soni was talking about. Obviously that changed with some new guidance that came from our governor and the DOE, and so we put a hybrid model in place. We had been working on hybrid models, and we had to modify it a bit. So we approved a hybrid model a week ago Tuesday, which is basically a 50-50, 50% online and 50% in class model, an AB model. So the first students get broken into Group A or Group B. If you're in Group A, week 1, you go to school Monday, Tuesday, Wednesday. You learn at home on Thursday, Friday. Group B is at home Monday, Tuesday, Wednesday, and comes into school Thursday, Friday, and the next week it sort of flips. So it was, a way to manage the state level requirement for that 50% in-person learning. And so we've developed that model. The district has done an amazing job putting kind of the plans and the logistics and how to eat, how to have students move through the buildings. What are we doing with extracurriculars and sports and I mean buses. It's really a Herculean amount of work in this time of COVID and social distancing to bring students back in. But we were also heartened because we provided also what we call PK-12 online continuous learning program, and about 47% of our district families opted into the online learning option. And so that's you have to opt in for at least a trimester. And so it differs by school building, which is interesting and not surprising. But about 47% of our families had opted for the online learning option only, which actually helps because then we had fewer students who would be on campus, and we could have more physical space for the students that opted for the physical option, the hybrid model. We had more room to manage students in the classroom buildings. And so we felt good about that. And so that was just a week ago Tuesday. Of course, when the school board met yesterday, we were looking at the newest positivity rates coming from Johnson County, and the tone and tenor of our conversation changed quite a bit from feeling pretty good. We're providing options to families that you could choose online or can choose the hybrid model. But we started getting, again, very concerned about the positivity rates and concerned that those are going to continue to be high. And so the school board is going to be monitoring that very, very closely. We actually are scheduling a meeting for Saturday to review again the positivity rates. Our teaching staff are due to go back to school Monday to prepare for students coming back to school on September 8th. And so if we are seeing strong trends in that positivity rate, we may choose as a board. I don't know what we'll decide, but we'll decide if we're comfortable with the plan that we've already adopted or if we need to make some changes. And it's really tough, Kim, because we want very much to provide certainty and a plan so that parents can plan, so that employers can plan, so that we can feel comfortable about the health and safety and the education of students in the district. And the volatility right now is making it really tough. And so we're committed from a school board standpoint to be on top of this, we'll meet every day if we need to make the kinds of decisions in a timely way so that we can communicate effectively what options there are for families. But I won't lie, this is a very difficult time trying to navigate this. And so that's from a school board perspective. Health and safety is number one priority. Educating our students is our second priority. And whether students are learning online or in a physical classroom, I can tell you the teachers in our district are amazing and are doing amazing work preparing whatever mode of education they'll be leading. And so just want to put a shout out to our teachers who are amazingly committed to this work. And so from an ACT standpoint, we're watching closely, and because we do have employees around the country, we're kind of having to monitor different regions and what local decisions are occurring. But listening to team members like Soni was describing at MidwestOne, we know who those working families are and trying to work with them individually to help them navigate their local return to learn plans, but then also what their work commitments may be and to provide as much flexibility as possible. We've got folks on different work schedules. We have some working families where they may work literally from 4 to 8 in the morning for ACT and go and do their regular job, and then work with the students while they're at home, and then tag team with a spouse or a partner and come back to work. And so we've been very accommodating for different kinds of work schedules wherever we possibly can, and we're just going to have to work, continue really focusing on the individual and what their unique personal situation is, and do our very best as an organization to support them, because these are very personal choices in some cases in terms of what's right for your family and going back to school. And our goal is to be as connected with our team members to understand what their needs are and support them in those personal choices that they feel they need to make, and we're there to support them.
Great, thank you, Janet, for sharing that. And thank you for your service on the school board. I mean, the school board is already, I think, a challenging and rewarding board to be on, but oh my goodness, during a pandemic, thank you for your leadership in that. I know we're all really grateful for that. So we do have a couple quick questions in the chat that I want to address, and then I'm gonna get to Jenny. First question is around how exactly, as an employer, you're evaluating whether an employee has anxiety that's high enough that they need professional help. As in this time, it seems hard to evaluate what is a reasonable amount of anxiety under these circumstances. I'll throw that out to all of you to see just kind of your thoughts around how you're measuring that and how you're determining that.
I can start, or Soni, do you want to jump in?
Oh, go ahead, Janet.
I'll probably be a little more high level. I bet this is something you've done more on, but you know, one of the things that again, that kind of pulse checking in with team members, how are they feeling? And so we kind of do that at an aggregate level and get some indicators. But we have been working with our team leads and managers and supervisors to look for certain things, changes in engagement level, and to check in with folks, because it could just be situational. The employee could be annoyed by a meeting they were just in, but to check in frequently and ask, how are you feeling? Is everything okay? And to have that dialogue and stay connected, I think, is one of the things that we're doing, and working with our managers and supervisors to be more aware, and to coach some of our team leads and managers who may not be as proactive in communication, to give them tools and coaching and mentoring on how to do that more effectively. And so, so we have those sorts of things that we're working on, but it's being connected with your employees and listening for change, and then checking in if you see something that's different. So it doesn't sound very scientific, but it's really staying connected and listening and noting when someone may be acting a little bit differently, that it's worth a check-in. How are you feeling?
I would agree. I don't really have anything scientific either, but again, kind of going back to the commercials that we did with our employee assistance program, knowing that first pulse survey that we had indicated people were stressed. They were, and they continue to be, and it kind of goes up and down. And some people can handle that better than others. And you don't know about all the other dynamics that are in a personal situation that contribute to a level of stress. So whether it is somebody having some things happen at work that is causing it, or just adding to it. Again, trying to encourage managers to be watchful of signs. I think, though, that we need to continue to do that by providing some more specific tools for that, because we've read a lot about signs of potential depression or signs of potential substance abuse or things like that. But we just need to learn about that a little bit more specifically as we go through this.
Great, thank you both for speaking to that. Second question is around flexible scheduling and leave options. What flexible scheduling / leave options have you provided for team members who work in positions where it's difficult to work from home or make up hours outside of the regular business hours? And for instance, we have a production team, we have production team members, and we're looking for ways to get creative about how and when they can do their jobs.
I can take that to start, and then Janet, if you want to add to it, we've got not necessarily production, but we have, obviously customer contact things roles where people, aren't able to do a lot of that job from home or remotely. So some of it is a hybrid approach, but the flexible scheduling guidelines that we just released, again, we're in the process of determining what those are going to look like. And we've put that to our managers and regional leadership to try to really figure out what's best for their location, their department, their team. But we have sort of developed a guideline of a range of when we feel like we can provide IT support around people working remotely and people that can't work remotely. We want to just make sure that they provide as much flexibility, and then we can have them supplement with pandemic pay hours if they need to reduce their work schedule or can't work the normal shift that they usually work. So a lot of that is to be determined. I don't have specific examples, but Janet said something a little bit earlier about team members working early in the day, then going to sort of a homeschooling situation during maybe the bulk of what we would normally do at work, and then coming back and finishing up at night. So that it's very similar to that.
It's interesting because when we first moved into the connected work and people had kids at home, you know, we reacted, I will say, fairly informally at sort of the team level, where teams were sort of making decisions around flexible work schedules, just because at the time we didn't know how long this is going to persist. And so now that it's obviously the sentiment from many of our team members is they want to be able to continue to work from home. You know, we're looking into formalizing a bit more some of what those flexible work schedules would be looking like. In a production environment, I'm familiar with those, and when we have staff who are, you know, working call queues and contact centers and things like that, and so we have been able to, for that team, to provide access to the tools they need to do that work from home. But they have hours that they have to be. If you're on a phone queue, there's certain hours that we publish that you need to be on. And so, but we have other queues, like email queues. And so we've been trying to move team members between email and phone, if possible, to accommodate different home needs and working schedule needs that team members have. And so, again, I'm not sure we're expert at that yet. We've tried to, again, be as flexible as we possibly can. You know, if you do have a production environment, and the only thing I could really think of is to stagger work hours, and if that's at all possible, and create sort of multiple shifts, if you will, to be able to ensure the productivity that you need, but to provide some flexibility for team members, depending on what their home requirements are. But that's the only thing I can think of from a production environment, because clearly you need to keep producing, but maybe there's some options for staggering work schedules, multiple shifts kind of thing, which I know is not easy to manage either. So there are some jobs that are really tough to provide that sort of flexibility. I completely get it. And I think in those cases, that kind of staying in touch and checking in, you know, and I would love to hear from Jennifer on the childcare options, because that could also alleviate some of the needs for some of these other kinds of flexible work schedules if we have good childcare options for families. So these are not easy. This is not easy.
No, and that is a wonderful segue, Janet. Thank you for, I was just gonna hop in to say, I'd like to turn the dial now to talk about childcare, but yes, so Jenny Banta, I'm very lucky to have her on our business partnership team. She has been working hard for a couple of years now on making childcare more plentiful, higher quality, more affordable. And so she's been working very closely with our childcare providers, and especially during this pandemic, and is also recently leading the launch of an initiative called Nests to particularly help vulnerable populations in need of care and learning during fall. So Jenny, I'm going to turn it over to you to talk about all that.
Well, first of all, I want to thank both of you for creating environments within your workplaces that allows for parents to juggle work and children, families. It's really difficult right now, but I wanted to give you all a little context on the child care crisis we have going on nationally and here in Johnson County. Nationally, we have about 41.2 million Americans who are working parents. About 23 million of those have all available adults in the workforce and unable to care for a child. The data here in Iowa paints an even more extreme picture. As you know, we are very hardworking here in Iowa, and we rank at the top, tied with Minnesota, for having all available parents working outside of the home. So I don't have data for Johnson County, but Des Moines has 28% of their workforce is made up of working parents. Prior to COVID-19 here in Johnson County, 76% of women were in the workforce, and there were 2.4 children who needed childcare for every one spot we had available. So I'll let that sink into you. that was a real crisis. And that doesn't account for children who were in school. So this issue is compounded by the fact that Johnson County parents pay more than twice the national average for childcare, averaging more than $12,000 a year for a child under age 4. By the way, that is tied for the highest in the state of Iowa, along with Dallas County. So I know that was a lot of data, but I wanted to try to paint a picture for you. Being a working parent in Johnson County means getting on a wait list for childcare. It means having childcare expenses that are higher than your mortgage or your rent. It also means a very difficult conversation about, is it worth me working, or should I drop out of the workforce and stay at home to take care of my kids? And I have adult kids now, but I do remember having that conversation when I had my second baby, and I know that a lot of families do after baby number 2 or 3. It's expensive. So to add another layer, COVID has created additional uncertainty to this problem, with more and more childcare facilities having to close temporarily due to outbreaks within their facilities. And I was speaking to Heidi Brown at the DHS. I think we had 43 childcare providers closed in the eastern half of Iowa at one point during all of this. So it has been pretty prevalent that childcare facilities have had to close for 2 weeks due to outbreaks. And then we also have a sustainability issue with the raising cost of running a childcare facility due to safety mitigation. Adding staff, adding thermometers and cleaning supplies, and having to spread kids out, it's a very expensive proposition. So on April 15th, we hosted our very first child care providers meetup. It turned into a support group. We've continued to meet every other week. During these meetups, we've shared resources, talked through safety protocols, talked about liability insurance, disaster insurance, everything you can imagine. So we've even discussed where to buy whole milk when there was a whole milk shortage, and also giving each other tips on where to find Purell Pure Surface, which is a hot commodity for childcare providers as well. So when we needed to, we invited special guests in to talk. We had Paul Heath from the SBDC, who helped us navigate PPP rules and whether or not it was appropriate for them to apply. Julie Allison from the Department of Human Services talked to us a few times, but one time in particular, she's talking about state grants for child care providers. We invited Senator Joni Ernst in, who had some proposed legislation to help fund child care providers and give them some extra money to help with that safety mitigation. And she also got an earful from our child care providers about what they were really needing in order to keep their doors open and just stay afloat as a business. So my goal in hosting these meetups was sustainability, trying to keep as many child care providers as possible, whether they were large centers or in-home providers, open. We just needed to keep them open so that when we tried to ramp back up, there would be spots available for working parents to utilize. During our meetings, I always ask 3 questions. What are your major challenges today? What resources have you found that you would like to share with the group? And how can the community support you? And these answers really drove my work for about 3 months and kind of put me on a track of trying to beat down every resource I could find for them, including whole milk, and just trying to make their lives a little bit easier. So shifting gears now, when the school district announced their return to learn plans, my focus shifted from preschool and childcare really to school-aged children. And when we talk about access to high quality, affordable childcare, usually we're talking about 0 to 4 years old. But when the school district announced that they were going to be going online or in this hybrid model, our childcare providers' phones started ringing off the hook. You have my 2-year-old, will you take my 2nd grader as well? Do you have spots, available to my school-age child? So with school moving online, at least part of the time, families are scrambling to try to find reliable childcare for their school-age children. Some of our childcare providers have been able to set up virtual classrooms and provide a safe space for children to access their school curriculum, and also provide some wraparound care when they are not online or in the classroom. If you're looking for childcare, I would encourage you to connect with CCR&R, Child Care Resource and Referral. They are amazing. They have a database of providers who are accepting children, and they actually have a link, I think, on their website still that just shows where in Johnson County you can go for childcare. Childcare facilities are charging about $200 a week for this service for school-age children. So that's an expense that working parents with school-age children probably didn't anticipate. So I think a really critical conversation for us to be having is how this is impacting low-wage earners and their families, and specifically how remote learning will impact that group of people who have to be in the workplace. They work on a line, they work in a restaurant, they work stocking shelves. How are they going to be able to balance that work-life dance that we all do? So with that in mind, a group of local nonprofits, business leaders, community members joined forces to give area students a place to study and access resources this fall, targeting at-risk youth who can't afford that $200 a week childcare. So we really had a great team working on this. We had 4Cs, Dream City, Open Heartland, UAY, neighborhood centers of Johnson County. We've had the school district involved, and so many more great partners helping us create neighborhood nests. And NEST stands for Nurturing Every Student Together Safely. And our intention was not to create a school. We are really going to lean on Iowa City Public School District or Clear Creek, Amana, or Solon to really provide the content. We just wanted to provide a safe space with reliable internet access, without distractions, with an adult there who could help them if they needed it. So the neighborhood nests serve as a safe space with trusted adults where kids and young adults can gather for academic success and emotional well-being this school year. So exciting news, 3 nests are currently being developed. We've got kids on a waiting list already even in Iowa City. So Open Heartland is targeting mobile home courts. Dream City is focusing on adolescent kids on the south side, and they are partnering with 4Cs, and 4Cs will be providing the younger age group with services through Dream City's facilities. UAY is working with teens on providing a quiet space to study, as well as participate in some much needed stress relief through art and music and potentially sports. We're kind of working on that too. These nests will work with small groups of students in a cohort using CDC guidelines and provide internet access, tutoring, social emotional support, and access to much needed resources. Much like what you heard, we want to check in with these kids and make sure that their social emotional well-being is really being taken care of primarily, whereas the school district is focusing on their academics. So with 3 nests launched, we realized that the need was not isolated to the south side of Iowa City. So we identified 15 neighborhoods across Johnson County that could benefit from a nest. So the group has now turned their attention to supporting other neighborhoods across the community through the Neighborhood Nest Network. The network was created to build a safety net of resources that can be duplicated and shared by others. And the Nest template can be modified and adapted for the unique needs of that neighborhood and will serve as kind of a centralized set of resources for groups wishing to stand up their own nests. So the Nest network will be meeting every Tuesday at noon to share best practices, answer questions, help with staffing. We'll have experts on from the Department of Human Services, from the school district, and we will help really train up the staff and volunteers that decide to open nests throughout the community. And another piece of really great news, the Community Foundation of Johnson County has created a neighborhood nests grant and will be helping to provide funds for those who want to try and do this work. So I think the most jarring reality of COVID-19, at least for me, with my own students coming home, has been a sudden and dramatic disruption to all levels of education, right? We're all feeling it. And I think we especially feel it here in Iowa City with college students. This disruption is expected to have deep social and economic repercussions for years. And I don't think I need to really go into details about that, but I do want to share a few little pieces of information. The NWEA study of the COVID slides suggests that students would return to school this fall with about 70% of the learning gains in reading and less than 50% of those gains in mathematics. So that, I think that's just really astonishing to me. And why that matters, as our students are about to start the school year virtually, at least in part, experts fear that students may fall off an educational cliff, missing milestones, falling behind in grade levels. But I think most importantly, getting back to what Soni and Janet said, just dropping out of the educational system altogether, just disengaging from the process. And according to McKinsey estimates, the impact to Black, Hispanic, and low-income students will widen the existing achievement gap by 15 to 20%. So I'm telling you all that because we're hoping that the neighborhood nests will help us eliminate that gap and help students just stay steady until we find that vaccine and get back to in-person school. We're hoping that the nest can provide one-on-one tutoring when needed to get students caught up, help us quickly identify those students that are disengaging from academics and who need resources like mental health services. And at the end of the day, we want to provide stability to families who are trying to balance work and their children's education so that they don't have to choose one over the other. So I'm really excited to see if we can scale up the nests. And, you know, right now we're pretty concentrated on the south side of Iowa City, but there's a lot of need out there. And I encourage anybody is interested, please connect with me because we'd love to get you plugged in and have you start joining our weekly meetings and see how we can help you launch a nest in your neighborhood.
Great. Thank you, Jenny, for sharing all that very important work. And I'm just always just constantly impressed just with our community and how just various groups just continue to come together to gap fill. And it seems just to be constant gap filling, but that we just, as we always say, we're in this together and, you know, we're going to push through and figure this out on all levels. And so, we're running out of time here, and there's just there was one other question that came in that I do want to kind of get to and bounce back to, and that was really around you know, and it's directed to the kind of school districts specifically, but I think it could apply to employers as well. But you know, how will staff, you know, or how will businesses or the district staff potential illnesses if there's a COVID-19 illness and somebody's out, you know, for 2 weeks? How are you managing that from a staffing perspective and supporting, you know, both kind of from a school district perspective with teachers, but then also employers with folks who are in critical roles?
It's a great question. I'm going to say I'm not sure we've completely figured it out yet from a school district standpoint, because we did go to online learning last spring. And so we haven't experienced this yet. And what we're trying to do is put in preventive measures as best we can, the health and safety, the PPE, protocols around sanitation. And so we're trying to put as many preventive measures in place to prevent our students and our staff and any building staff, teachers, paras, nutrition service workers, custodians, librarians, school nurses. Our goal is to prevent the illness from spreading in our school buildings, but we know that's naive to think that it's not going to happen. And so it's a really great question. And I don't know that I have a great answer on that yet from how the district has planned it. Flexible scheduling, leaning on substitute teachers, as we need to, if teaching staff are needing to be in a, not being able to work if they're ill, but we also have opportunities for online, because we do have online learning programming. And so if someone's asymptomatic but tests positive, potentially they could continue to teach online. And so these are a lot of questions. We haven't experienced it yet. I can say that we will be as responsive as we possibly can be to fill any kind of staffing gaps that we experience through illness or needing to quarantine. And the district team is amazing, and we'll work their way through it, but we haven't experienced it yet. So I think, have a lot. We're going to prepare. We're going to prevent, prepare, and then react as it hits. And from an ACT standpoint, we haven't experienced it yet either, because we've been working connected, except for that handful of folks that we have working physically in our buildings. And because it's so few, we've been able to manage and prevent any kind of outbreak at ACT. So there's more to come on this one as we get back into school, for sure.
Soni, how about you on the workforce end, and particularly too, I think of how MidwestOne Bank, you've got younger folks, students working in there, and kind of navigating that as well, and the uptick. How are you managing that?
Well, just from a standpoint of critical essential workers, we're all essential workers in the bank, but we have to then go internally and figure out critical roles within each department to keep things going should an outbreak take place, and who's sort of primary, who's secondary, and on down that chain. What I will tell you is that as we've worked through since the spring, when we started to see cases of potential exposure or real exposure, the probable exposure, the potential exposure, and then the real exposure, it was a lot easier to respond and resolve when I had a manager that said, yes, we were wearing masks. Yes, we were socially distanced. Yes, we've been cleaning surfaces. Yes, our building was cleaned last night. No, there wasn't prolonged close contact. And even though we had an outbreak, the risk gets lowered considerably for potential other infection. And we've even used those examples on our manager forum calls to say, when you answer those questions that way, it's a lot easier to deal with than, well, we weren't wearing masks and we weren't distancing. And that was the case in some of our facilities 2 or 3 months ago. Remember I said we had that spectrum of anxiety. We also had that spectrum of really what people were doing that we thought they were doing. And now I think it's really come together and it's a lot better now. So again, we haven't had the horrible outbreak where it's taken a whole team down, but we've certainly run some exercises to lessen the risk.
Great, thank you for sharing that. Well, we are just about at time here, and one last quick question for you all. I was trying to end on a positive note. Any silver linings for this fall? Anything that's kind of potentially a positive outcome to all this?
Part of it is the ingenuity, the innovation, the solutions that people are bringing to problems that we never in a million years imagined that we needed to solve for. I think a silver lining at ACT and in the school district is just that spirit of being together, working together, solving problems, having grace, understanding this is new and we're learning. I love what Soni just said about the lowering the risk and talking about, boy, this is really different because you've got the face covering and the distancing and that's a great learning. But I think for me, it's just the coming together of people in the spirit. And I heard it through Jennifer's remarks around nests too. That's the community coming together in a beautiful way to fill really, really critical needs. And just want to thank her for providing that leadership and guidance. But spirit of working together to solve really big problems is a bit of a silver lining. I think the relationships we're building are going to be long lasting.
I would agree. And just the resiliency that I think we found within us kind of came out when we thought we were resilient. We've really found that we really are much more than we thought. And the relationships, I echo that so much, whether it's a first line supervisor that needs some help or it's a colleague on my senior management team. I mean, it's just a strengthened relationship with our staff. So that makes me feel really good, although I don't want to do this again. So that silver lining is it's so great that I want to just keep doing this. I'm looking forward to an end.
Well, and I wanted to just kind of bring it back to childcare. I think that we have also put a spotlight on some more vulnerable aspects of our infrastructure. And I use that word because I was in a meeting a few weeks ago and somebody referred to childcare as infrastructure for the first time I'd ever heard that. And if you really think about it, childcare really is a way for parents to get to work, right? You need to have that. So it is infrastructure. And I think right now, just watching, I'm kind of a political wonk and I'm listening to the conversations that are happening in DC, and they're having those conversations now about how important childcare 0 to 4, how important that is for our workforce and for the children to have, a safe, nurturing environment from age 0 to 4. So I think that that's a silver lining. I have been beating that drum for a little while now. And so to hear that and to know that the conversations in DC are changing and in Des Moines are changing, I think that is the silver lining for me.
Great. Well, thank you to all three of you for being on this webinar today and sharing all the great things you're working on. Thank you for your leadership in your organizations. Thank you for your leadership in this community. We're in this together and hope to all see you again soon. Thank you, everybody, for joining us today.
Thank you so much. Good to see you. Thank you, Kim.
Good to see you all. Thank you.